Basically, our job is to, right here with this next couple slides, is kind of present the umbrella of what are the overarching goals of healthcare reform. What were the policymakers trying to get at and deal with in terms of creating a law? And, how do we understand that with regard to the specific components that I'm going to talk about? So just to put it in a more understandable manner, it'd be like showing you the forest before we take a walk through the trees and look at the specific components. So as you can see, the law is going to greatly increase healthcare coverage. Here's before the law is enacted, and this is after the provisions take effect. If you notice, the two biggest increases are going to be persons covered by Medicaid in the Children's Health Insurance Program and persons covered by private insurance. You can see the escalation from 38 to 53% in private insurance and from 22 to 29% under Medicaid. That's the expansion of coverage. We're predicting that this law is going to result in the coverage of 95% of New Mexicans and 95% of Americans. That's according to the Congressional Budget Office. What else is this law going to do? It's going to provide greater security and protection for those who have current coverage. It's going to end many of the insurance industry abuses, discrimination, and injustices. It's going to require free preventative and wellness services be part of your plans. It's going to improve consumer choice. There's going to be a benefit to seniors, and I'll talk about each one of these specific components. And it's also going to significantly reduce the federal deficit. So that's kind of the overarching framework of what are the goals and ethos behind this law. But then let's get into the specific components about what this law is actually about and how it does that.